Hey y'all, this is Shannon, the Iron Nurse Practitioner, and y'all have discovered that you're iron deficient and you've been ordered IV iron, and one of the top things that you're going to be ordered is Venofer or iron sucrose. So let me tell you all about it. Okay, so the background on Venofer is that it was approved originally for iron deficiency anemia in those with chronic kidney disease, both on dialysis and not on dialysis. It is also approved for children with restless leg syndrome, so children 2 and older. It is also approved indication to get Venofer. And also pregnancy, it was the only IV iron product that has ever been studied in pregnancy in second and third trimesters. And then also an interesting side note that we'll be talking about later, it was approved for those with high phosphorus levels called hyperphosphatemia to bring down phosphorus levels. And a new kind of interesting side note is that there is a generic form that has just been announced that will be coming out. So it's already an inexpensive drug, but it's going to be even better for prices because there will be a generic form available. So how is Venofer given? So the drug insert and provided by the drug company that manufactures Venofer, it is indicated to be given 200 milligrams times 5 doses, not to be given any faster than 14 days. I've seen a lot on these blogs of people talking about they're getting the Venofer 200 milligrams once a week times 5 weeks, and that is a provider's choice. They just can't give it any faster than over 14 days. And they are supposed to give it in no less than 15-minute infusion times for 200 milligrams. Okay, so what are the pros and cons of getting IV Venofer? Well, first of all, that your insurance is going to approve it. You're not going to have any delays with insurance for prior authorizations or having a peer-to-peer for the doctor to discuss why you need this drug. So you're going to get this one and you're going to get it relatively quickly. So that's awesome. Second is if you're pregnant and iron deficient, it's the only one that's ever been studied in pregnancy in the second and third trimester, and it's been proven to be safe. So it is a good option if you need IV iron and you're pregnant. But a couple of the things that are cons. So it is the only IV iron product that I have ever seen burn at the IV insertion sites. So your vein tends to get very irritated by Venofer and it burns. So these quicker infusion times of 15 minutes, I've had a lot of complaints about burning at the IV site. So slowing it down helps. Going with a bigger vein helps. Just know that this can happen and you can tell your nurse to slow it down because it burns. The other thing is that it can cause pseudoreaction and iron overload type symptoms with these fast infusion times of 15 minutes. There's at no point in time that your body is carrying around 200 milligrams in its bloodstream. So when your body is trying to process 200 milligrams, especially as quickly as 15 minutes, you can have these pseudo overload and pseudo reaction symptoms. So you can have chest tightness, palpitations, your blood pressure dropping, getting sweaty, getting hot. All those things are a symptom of getting that iron too quickly, but feels like a reaction. And so just slowing the drug down can eliminate all of that from ever occurring. So I always tell patients to ask for your infusion time to be over an hour for your iron, especially Venofer, so that you don't have these symptoms. So most providers will not have any issue with you going slower with your IV iron. They just won't allow you to go faster. So if you just ask your nurse very politely, they should have no problem slowing it down for you. Hypophosphatemia, so low phosphorus. One of the indications for Venofer is treating high phosphorus levels or hyperphosphatemia. So you can experience low phosphorus with IV Venofer. And I did another video where I explained that the likelihood of you getting this is based on your vitamin D and calcium levels. So make sure your vitamin D levels are good before you get your Venofer, and make sure your calcium levels are good, and or eating a high phosphorus diet with your IV iron treatments. And that should usually eliminate some of those side effects, but they would look like feeling wiped out, like you absolutely cannot do anything you have to sleep all the time, all that. That would be some of the symptoms of having some low phosphorus levels, but you can check out that other video about that. And then the other problem is most of the time my patients complain about it takes 4 to 5 treatments before they start to notice that their improvement in their deficiency symptoms. So just keep your expectations that you may not notice anything the first 1 to 3, even 4 treatments. So know that that is a possibility. And then the other part going into that is that I have had patients, especially when you're severely iron deficient, not normalize with a full course of Venofer. So know that you may need another round of IV iron to normalize your iron levels after Venofer. That is one of the things with just the 200 milligram doses I have noticed, especially with women that are still menstruating and they may be losing the iron while we're giving them Venofer. Okay, I hope that helps you. If you have any questions, leave them in the comment section. Please share it with anyone you think this may help. And thank you for watching. This is Shannon, the Iron Nurse Practitioner.